So in this segment of Thyroid Thursday, we're going to talk about strabismus and double vision associated with thyroid eye disease. And when patients have thyroid eye disease, they often have double vision. And this double vision can be from the muscles getting large or scarred or fibrotic, and it causes patients to see double, either looking straight ahead or side to side. Fortunate to have known Dr. Stacy Pineles from UCLA Joel Stein Eye Institute for many years, and she is a world expert. I say that with all admiration in this disorder. So it's really our pleasure for the next several series to be discussing what is strabismus, what should you be thinking about in choosing someone who treats this process, what is available to treat it, and then what are other surgical, non-surgical options that you may or may not have considered. So, as you know, and anyone who's been afflicted with thyroid eye disease, looking up or even looking down, side to side, often can cause a lot of blurring or double vision. And so, Dr. Pineles is a strabismus specialist. So I'm going to let her talk about what that means, what does the term strabismus even mean, because it's always a tongue twister, and then what kind of training someone who has double vision should be looking for in such a specialist like herself. Stacy, thank you so much.
Thank you. So strabismus is an umbrella term for any sort of eye misalignment. So it can mean that a patient has eyes that are not lined up correctly and looking in the same direction, either horizontally, so the one eye is turned in or out, or vertically with one eye up or down. And strabismus can occur even if a patient's eyes are straight when they're looking straight ahead. Occasionally, especially in thyroid eye disease, when a patient looks in an eccentric gaze, like to the right, left, up, or down, as Dr. Douglas mentioned, sometimes there can be eye misalignment only in those directions of gaze either. So strabismus is really an umbrella term that encompasses all types of eye misalignment.
Great. And so strabismus surgeons actually are ophthalmologists, and they go to ophthalmology residency, medical school, obviously. What type of training should someone who has double vision, how do they find a strabismus specialist, and what type of training is important?
So exactly what you said. So strabismus surgeons are ophthalmologists who go to medical school and receive an MD or DO degree, and then they go on to ophthalmology residency. And then for specialized training in strabismus surgery, many physicians who are experts in this area go on to a fellowship. The majority of fellowship-trained strabismus surgeons do their fellowship in pediatric ophthalmology and strabismus. And that's a little bit counterintuitive since most patients with strabismus due to Graves' disease are adults. But the appropriate training for strabismus surgery is typically done during a pediatric ophthalmology residency because the majority of strabismus cases that aren't due to Graves are actually found in childhood. So the people who have performed the most strabismus surgeries during training are really those who have trained in pediatric ophthalmology and strabismus. There are some other specialists who perform adult strabismus surgery and have very excellent training. Those people are trained in certain fellowships in neuro-ophthalmology and also oculoplastics and orbital surgery. There are some fellowships around the country that do a very good job of training those types of individuals as well. But overall, the most common fellowship training that's utilized to perform adult strabismus surgery is pediatric ophthalmology.
Yeah, so don't be surprised if you walk into the office like many of my patients and see all kids and wonder whether you're in the right office or not. But you bring up a great point about some other subspecialties of ophthalmology do strabismus surgery in adults just because it's kind of a specialized thing. Are there a certain number of cases, or when people are trying to figure out who to go to, just whether they've had experience in adult strabismus? Is that probably the best thing for them to ask, or thyroid eye disease, strabismus associated complications?
Yeah, I would say that a person who's performing strabismus surgery on an adult with Graves' disease should have training in adult strabismus surgery. And they should, in their practice, be doing at least 10 to 20% of their cases adult strabismus surgery.
Great. So that's a little bit about how to find the right specialist if you have double vision and strabismus. We'll talk in future segments about what is double vision, how to diagnose it, and how to treat it. Thanks so much.